Amid the complicated developments of COVID-19 pandemic, some cities and provinces in the Mekong Delta region have recorded multiple infection cases, and as a result, a great number of F1 and F2 individuals. Promoting the volunteer spirit, Cần University of Medicine and Pharmacy has sent many delegations of officers and students to the front line to support all the localities in COVID-19 pandemic prevention and control. For the past few days, the pandemic situation in the Mekong Delta provinces and in Cần City alone is evolving complicatedly. In the provinces of Vĩnh Long and Đồng Tháp, the number of F0, F1 and F2 individuals are on the rise, especially the cases from the infection clusters of Sadek General Hospital or the Sewing Company No. 6 in Đồng Tháp province. Many cases related to the Xuân Limited Liability Company in Hòa Phú Industrial Zone in Long Hồ District in Vĩnh Long Province. The People's Committees of Đồng Tháp and Vĩnh Long have issued official dispatches and asked for support from Cần City and Cần University of Medicine and Pharmacy in pandemic containment. Cần City People's Committee agreed with tasking the steering board with developing and arranging the team for tracing and test sampling for community infection in Cần City and Mekong Delta provinces. I believe that when carrying out your mission in Vĩnh Long province, you will strictly adhere to COVID-19 prevention and control regulations, ensure safety, overcome difficulties, and accomplish the missions with the highest efficiency. 3 officers and 44 medical students majoring in general medicine, preventive medicine, and laboratory testing joined the delegation that supports Đồng Tháp province in tracing cases related to COVID-19 infection. To support Vĩnh Long province, the university allocated 8 officers and 90 lab testing, nursing, and preventive medicine students to supervise medical declaration, trace, collect samples, and perform community infection testing at Hòa Phú Industrial Zone in Long Hồ District in Vĩnh Long province. The delegation will collect samples of about 70,000 workers there in an expected period of 1 week.
Lịch trình hoạt động trong một ngày của em ở Vĩnh Long là như thế nào?
Our workday begins at 5 a.m. We have breakfast and wear protective clothing afterwards. We are then transported to Hòa Phú Industrial Zone to prepare for collecting samples at 7 a.m. Each shift lasts for 4 hours and there are 3 shifts a day. We take turns to cover 1 to 2 shifts each day. On average, I collect 100 samples per day. I sometimes feel tired, but I was equipped with the knowledge, mental capacity, and national pride to help me overcome the strains. In Cần City alone, from June up to present, there are about 150 volunteers performing the task of supervising medical declaration, logging information, tracing, collecting samples, and infection testing in the community in some wards of Ninh Kiều and Garang districts. Our main responsibility at this time is to support CDC staff in collecting test samples. As a future physician, I was equipped with the knowledge and skills and will use them to contribute to pushing back the pandemic as soon as possible. The university has built 2 volunteers delegation. One is for community service and the other is for service at field hospitals. We focus on providing students with the expertise in infection prevention, especially preventing cross-contamination. Cần University of Medicine and Pharmacy have founded volunteer groups of about 3,000 officers and students on standby to provide assistance to all the localities in pandemic prevention and control.